Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Annosodas Vyadhi and we have discussed Chardi in detail. On the background of the Chardi, we have discussed different principles of Chikitsa Sutra and their clinical application. Today we will discuss another Vyadhi and it is called as Atisar. The principles we have discussed about Chikitsa in the Chardi discussion, most of them are applicable in Atisar also. So let us discuss Atisar today. What is Samprapti of Atisar? This Samprapti is very important because on the Samprapti, basis of Samprapti, we can explore the different karma. How? Let us discuss. Now, Samprapti of Atisar, there is Vata Prakop and there is Jaladushti. Because of Viruddhana, bad water hetu, you can go through them. So, this Prakupit Vayu brings Jaladhatu, which is Dushit one in the Koshta. Now, what happens in Koshta? There is Agni. Now, Jaladhatu is Dushita, and this dominant Jaladhatu, when comes in the contact with the Agni, obviously there is going to be Agnimandya. Whenever you learn Agnimandya, always remember Amodpatti is the next step to be happened. So, in the Koshta, when this Jaladhatu comes in the Koshta because of Prakupit Vayu, it creates Agnimandya and Amodpatti. Where this happens? This happens in the Grahani Avaya. After this Agnimandya and Amodpatti, the Gati of Vayu is continuous. It has not stopped. So, Vata dosh forces this Jaladhatu further in the Annavasrotas or in the Mahakoshta, and it brings this Jaladhatu in the Pakvashay. In the Pakvashay, during movement, what is the last part is the rectum or Malashay, and what is the Bhavadartha? Malo, Purisha. Now, this Dushit Jala has come at the end of the Pakvashay because of Vata dosh, and it comes in contact with Purisha and makes it that Purisha also Dravibhuta. It happens in the last part of the Pakvashay. But Samprapti doesn't stop here because Gati of Vayu is still going on. So what will happen? This Vayu will expel this Drava Purish out of the body, and this symptom of the patient tells you as a loose motion, and we call it as Atisar. So this Samprapti starts right from the Vata Prakop or Jaladushti and traveling through the Koshtha. It ends after the expelling of the Drava Purish, and what we call it as Atisar. So this is the diagrammatic. I don't think it is getting it right. Okay. So on the basis of this Samprapti, we can explore different karma. What are they? Mainly Grahi and Stamban. Definition of Grahi is Deepanam Pachanam Yasyat Ushnatvat Dravashoshakam. To stop the Atisar or to break the Samprapti of the Atisar, we have to take care of each and every step which has happened in the body. So what has happened? Firstly, Vata Prakop Jaladushti. So we have to reduce the Jaladhatu. Then Agnimandya Amodpatti in the Grahani. So you need Deepan Pachan. So Grahi Karma, which is important in this case, why? It is Deepanam Pachanam. So Agni Mandya will be taken care of, Amodpatti will be taken care of, and Atisar, Ushnatvat Dravashoshakam. So what is the liquid Dushit Jala Dhatu will be get Dravashoshanam. It will get dried out. So this is the Grahi Karma we can explain on the basis of the Samprati of the Atisar. When Agnimandya Amapati is taken care of, sometimes there is only loose motion, what we call as Niramatisar, and where only you have to stop the loose motion or stop the gati, and where we use the karma stambhan. So for Samatisar, you have to give Grahi because there is Samata and Agnimandya. Sometimes there are plain loose motions without Samata. Only liquid is getting expelled out, liquid marble, Dravapurish. In that case, you just have to stop that gati, and in that case, you use Stambhan Dravya. Always remember, in the text, many a times Grahi and Stambhan are used as synonyms. So we have to find out the exact meaning in the reference of that particular shlok or sutra. But Agnimandya, Amutpati, Dravapurish, Grahi and Niramatisar Stambhan is a clear-cut difference. As I said, in Shardi, what the principles we have seen, different principles, and accordingly the treatment changes, most of them are applicable in Atisar also. What first thing, Saman Doshan no stambha, or it is, I don't know, remember the exact shambha. The dosh which are some are getting expelled out, ignore them, because if you are stop them, they will create other diseases. So in case of Samatisar, if Sama dosh are getting out of the body, then ignore, convince the patient that let 2-3 some more Vega if come, then ignore it, don't get frightened. First thing. Second principle, what we saw, if patient is durbala, there is dehydration, then in spite of samata, stop the Atisar, because Rasakshay will create other problems. So this principle, which is in Chardi, equally important, equally applicable in Atisar. It is also applicable to stop the Atisar, though it is Samavastha, in the Durbal Rugna, in the Krusha Rugna, in the Garbhini Avastha, in the Jeshta Vai or senior citizens. So again same thing, though it is Sama, stop it, because there are chances of dehydration and Balakshay. Fourth one, when there is Raktaja Atisar, that is bleeding through the this loose motion, stop them immediately, because Raktam Jivam iti sthiti. So like Chardi, if there is some dosh getting out of the body, ignore them if patient bala is good. Secondly, patient is Alpasatva or Alpabala, Krusha, small children, Balaka or Jeshta, senior citizens, then stop that in spite of Sama Avastha, because patient is not going to tolerate the Balakshay because of Atisar. If there is Raktaja Atisar, stop it immediately, because it is Rattam Jivam iti sthiti. Among all this Samprapti, what we have discussed now, there is another major factor you have to keep in mind is Krumi, especially in the small children. In that case, along with the Chikitsa of Atisar, what is the Grahi or Stambhan, you have to add Krumi the Chikitsa. And third, another fourth point to keep in mind, side effects of the other medicines, especially in antibiotics like amoxicillin. You have to ask the patient if he has taken any other drug which is going to create Atisar as a side effects. In that case, this Samprati of what we have learned, Vata Jala, is not applicable. You have to give only Stambhan, or you have to ask the patient that you have to take care of this Atisar because your medicine is going on, that which is creating side effects. So this is about the Grahi and Sambandh, very commonly seen and easy to uh, treat the disease in our practice. So I just mentioned it today. Thank you very much.